about SI joints. Almost every human being on this planet know what's the SI joint pains. A lot of patients come to the clinic and say, I have a lower back pain. After specific tests, we find out it's not the lower back pain, it's the most SI joint pain. What's the SI joint pain? It's a sacroiliac joints. This is joints between your sacrum and your ilium. And that's attached right in here, right in this area. I'm gonna bring the camera close. And sometimes what's happened to those joints, they not lock properly because poor postural, unbalanced hips, it's called sacroiliac torsion. What's happening? This is the most common cases, so be careful and get that life hack or tip. Remember and use all the time. The most people effective, it's after pregnancy, and people who sitting and bending to the side a lot. So what happened with those SI joints? When you try to bend, so as you know, this is the stable joints. We're not supposed to mobilize these joints. A lot of people start mobilize these joints. So the problem is, a lot of people try to bend this way, which is activate my ilium for bending and grab something. Now think about it. I'm gonna come in this way, which is unband my knees and everything in my sacrum and my ilium, and I try to pick it up. Now I'm twisted and I drop it down, whatever I put, and try to stand up. In this case, those joints not locked properly, and that's caused enormous pain. This is so painful. It's by 10 scales of 10, it's a 10. And then most times, sometimes it go right to your lower back. That's what the most people think, oh my God, my lower back. And they go to the therapist or physical therapist and they treat that pain, because when you come in, you say, I got a lower back pain. And most therapists try to chasing pain, but the simple test can show you is that SI joints or not. So go to the professional, do treatment tests, and after you find out you have a SI joint pain, we show you a couple exercise, corrections training, let's say this way, to help you improve your SI joint. So no bending and no lifting. If you want to lift something, you use your glutes. You sit down, you grab what you want, and now you push through your hips. You push through your glutes, activate your glutes. This is how you lift things. Okay? So remember that tip, and you might never have SI joint pain. Now, ladies after childbirth, by natural way, they open your pubis symphysis. As you're looking around, so that's right, open for the baby delivery. What's happened here? We lose that stability in that SI joint sacroilium area, and that's caused a lot of problem. So after childbirth, after your recovery, start focusing on your core muscle. Everyone who has SI joint pain, this is the core muscle. You have to strengthen your abdominal area. You have to strengthen your glutes. Good glutes always help with the lower back pain and SI joint pain. So make your glutes stronger. Make your abdominal area stronger. Make your core stable. This area is supposed to be stable. Don't try to mobilize that. Remember that? Now follow us. We show you those correction program exercise. So now let's talk about those correction exercise. I think we're gonna split this in two part. First one is gonna be more put this in the right positioning. It's kind of, let's say, adjustment, self-adjustment. Make sure it's no pain during those correction exercise. And the second part is going to be more strengthening this area, strengthening your glutes and working with resistant bends. So our first correction exercise, we're going to try, like I said, we'll try to put those SI joints. If you have a sacroiliac torsion, SI joint pain, they might be not in the right position. So we try to get them back in the right position. And the first exercise, training, it's going to be dropping your hip without any pain. If you do feel pain, stop this exercise. The idea is just try to go without pain and I just feel a little click right in my SI joint. That feels so great. And so repeat maybe 4 or 5 times per side, very deep and slow, don't rush. So the next one is going to be squeezing, and we're going to place in 90 degrees, and you try to push with your arms inside, and your legs is going to be helping and pushing outside. So you kind of resist with your own arms. Breathe, and you're going to feel maybe one side weaker than the other. Okay? And the next one, you're going to be surprised. You're going to start squeeze. You can use 2 fists. You put right here between your knee, and you try to squeeze now. And I actually feel pop. You can try to squeeze and put it down position. In this case, I'm going to use my foam roller, and I start squeezing. I feel a lot of popping right now, and releasing. Sometimes you feel pain on the one side. That's mean one side is unbalanced, so your hips is unbalanced. And the next one, it's called bicycle. Let me go this way so you're gonna see better. Basically what you do, you resist it with your arms to your legs. One arm is coming right about below the knee, and one above. And what you try to do, this knee is try to go towards your body, and this leg is try to go away, but you resist it with your own arm. In this case, you start shifting those ilium, and of course, relationship with your sacrum, and you start doing that. Lay down and breathe. Try as hard as possible. If you feel pain, stop. Now you switch arms, place below and above, and same thing, and you're gonna feel complete different. You can put the stick. I've never done this before, but I see people doing that, so it's kind of ideal like this. 90 degrees, and it's actually worked really well too. I can feel it. Now you can switch it, and it's feel fantastic. So do this exercise right. If you feel pain, stop, call your doctor, come to a manual therapist. They will help you out. Okay, so strengthening exercise is more focusing on the core stability, and in this case we're going to use the resistance bands. Like I said, this is if you in pain. We're not trying to be superhero and do crazy stuff, but with the progression you can go do more like a bridges, single leg bridges, different quadrupedal exercise. Everything we do it on the floor, so we don't want to put the gravity on our spine and our SI joints. So simple exercise. We're gonna bring a lot of flexions in our hip, flexion, rotations, extensions. Simple exercise. You're gonna lay down and put the band right on your foot, and what you try to do, you just try to get as close as possible. After, you can go 90 degrees. Let me switch this way so you can see better. Bring back, breathe, and also bring it back as slowly. Don't drop, so don't do that. Just stretch, hold, and bring it back. Okay, the next one, same thing, not going anywhere. You just lift the legs straight up, very slowly, lower down. I can feel it's activate my gluteus muscle, minimus, maximus. Now you abduct, abduct your leg. You can do abduct and abduction, abduction and abduction. Go back. So play with that. Don't just stay in the same pattern. Don't do 15 times. I probably do 3 times like that, raise them up, go to the side, every time. Put on my foot, play with my foot, 1 foot rotation, rotation in, rotation out. It's actually feel fantastic. I feel right in my SI joints, and it's activate all those deep 6 muscles, all those activation. So make it stronger, not to mobilize it. A lot of people start doing mobilization, and that's not the good idea. So this is the strengthening of. So this is the strengthening and help your SI joint pain. Do this exercise, you're going to feel fantastic. Also, you can flip on your stomach and do the same thing. You can do